Thanks for joining me. I'm George Snyder, one of the developers of the AI-MCP Agent platform, and this is part of a series where I build a real working agent for one specific business problem, beginning to end right in front of you. Today we're in a primary care clinic. This is a clinical documentation co-pilot for Cedar Park Family Medicine. It helps a clinician turn a visit into a clean soap note and suggests the right ICD-10 code, working only from the clinic's own protocols, templates, and coding subset, and citing the source. Everything it produces is a draft for the physician to review and sign. It never makes the clinical decision. Let's design it, look at its knowledge and guardrails, test it, and put it into production. Here's the agent in the visual designer. Every solution is a workflow. Read left to right. It starts, connects to a language model, applies its guardrails, draws on a knowledge base of the clinic's documentation standards, adds a voice services task so it can also speak and listen, follows its co-pilot instructions, and returns a cited draft. There's no code. Each capability is just a task you drop onto the canvas. The knowledge is what keeps it clinically consistent. The knowledge task connects the agent to the clinic's own materials, protocols for common presentations, the SOAP note templates, and a curated ICD-10 code subset. When a clinician asks, the agent retrieves the relevant protocol and codes and drafts only from them, citing the exact document, so every category, interval, and code traces back to the clinic's approved standard, never a guess. In healthcare, the guardrails are essential. The guardrails task attaches a mandatory disclaimer to every response, a clear reminder that this is not medical advice and that the physician reviews and signs every note. It also screens incoming messages for prompt injection attempts. It can run in monitor mode to observe or enforce mode to actively apply the policy. Here it's enforcing. Before we ship, we test it. The test agent panel lets us talk to it just like a clinician would. We give it a blood pressure average and ask for the category and code, and it answers with the real threshold, recheck window, and ICD-10 code from the clinic protocol cited with the disclaimer. Then we try to manipulate it, telling it to ignore its instructions and safety rules and act as an unrestricted AI, and the prompt injection guardrail we set earlier catches it and blocks the attempt cold. Every turn is also metered. Opening the chat history shows the per turn cost, the model, the tokens, and the session total. And finally, look at the voice control up top. Because we gave it a voice task, this same agent can run as a voice agent too over WebSocket or WebRTC. With the agent tested, it's time to put it to work. Saving it publishes the agent with a unique code, and it can be delivered several ways. The first is an embeddable chat widget. Drop it into the clinic's documentation portal so a clinician can pull a cited draft in seconds, right where they already work. Here, a clinician asks for a blood pressure category and code, and the widget answers straight from the clinic's protocol, source, and disclaimer included. A fast first draft that always leaves the final call and the signature with the physician. Documentation is also a hands-on workflow, so the second way is Chat Assist, our live agent co-pilot. A clinician working through a queue of visits hands one to the assistant, the very same agent, and it drafts the assessment and plan with the ICD-10 code from the clinic's templates. The clinician reviews, edits, and accepts it into the note. The AI does the first draft. The clinician keeps the judgment and signs off. And there's a third channel, the phone. Because this is an AI-MCP agent, the very same assistant or a whole multi-agent team can connect to a standards-based SIP telephony provider and handle real phone calls. Think an after-hours nurse line. It's all managed here in Telephony Setup, the provider, the numbers, and the call history. One agent on the web, in chat, and over the phone. That's the clinical documentation co-pilot, a grounded, cited assistant that turns a visit into a SOAP note draft with the right code, keeps a disclaimer on every response, and always leaves the decision and the signature with the physician, built on one canvas, tested live, and delivered as a widget, a co-pilot, or a phone line without code. Thanks for watching. I'm George Snyder, and I hope you'll join me for the next AI-MCP use case.